I would say that if you imagine walking down the street, going to work, and you're the point in the road where you normally cross, you're about to cross, and suddenly a lorry comes hurtling along, and you have to jump back from the road, and your heart's racing, and you're feeling sweaty in your hands, and you're beginning to have some confused thoughts, and you just stand there for a moment. That is fear. There was a real danger, and your body was responding to that with a fear reaction. Now, if the next day you were walking on the same street and got to the same point, and you started finding that your hands were feeling sweaty and your heart was racing, but there was no lorry there, that would be anxiety, because what anxiety is when there is no immediate threat, but there's similar bodily sensations and thought processes can be going on. Hi, I'm Colette Hirsch, the Professor of Clinical Psychology and Cognitive Psychology at King's College London, and I head up the Generalised Anxiety Disorder Service at South London and Maudsley NHS Trust. Today, we're going to be talking about anxiety, and in particular, generalised anxiety. If you were worrying now, and I had a £100 note that I'd give you if you were able to stop worrying, would you be able to stop worrying? People with generalised anxiety disorder wouldn't be able to stop, even if they were very motivated. Now, we all feel anxious at time to time, but when it becomes really problematic, it can be a clinical problem. And if you feel anxious in lots of situations and worry a great deal about lots and lots of things, that may be generalised anxiety. And if it gets interfering with your life, it could be generalised anxiety disorder. Generalised anxiety disorder is when, for a long period of time, at least 6 months, people find themselves feeling really anxious and worried more days than not. But typically it will be every day. And they'll also have a number of physical symptoms happening, which are common anxiety symptoms that combine with that. Now, you might have that worry and anxiety, but only will you be seen as having a disorder if it actually interferes with your life and causes you a great deal of distress. Now, one major component of generalised anxiety disorder is the tendency to worry. And again, we all worry from time to time. What I mean by worry is really entertaining negative outcomes. Oh my goodness, it could go wrong in this way, or this way. People will worry about a range of different things, but if it's lots and lots of different topics that change all the time, that again may be part of generalised anxiety disorder. So generalised anxiety is a disorder when it's really interfering with your life and it's been a long-term issue. And it's really that lots and lots of different topics can cause you to feel very worried and anxious. Your mind will move from one topic to another as you're worrying. And it would be that you can't control your worry, so you can't stop yourself worrying. Anxiety, as I say, is a really normal part of life, but if you're trying to reduce your anxiety, then there are certain things that you can do to really help yourself. So exercise can be really good at reducing anxiety, eating well and sleeping. Now, sometimes the sleeping is a problem if you're actually really anxious and it might be interfering with your sleep. You could also try and do some things that you find relaxing and really taking time out of the day. Those would be some kind of things that you could just change your lifestyle a little bit to see if those will help. Also, people sometimes find that anxiety is really increased when they have drunk lots of alcohol the day before, or they're having lots of caffeine. So again, those kind of things could also be useful to try and cut back on. If you look at the different forms of treatment for anxiety, when people do have anxiety disorders, the recommended approaches would be medication, so would actually be often termed as antidepressants often, or psychological therapy. The most effective form of psychological therapy with the biggest evidence base is cognitive behaviour therapy, or CBT, where you'll work with a therapist to try and change the unhelpful thinking habits that keep anxiety going, and also change your response and behaviours in relation to the anxious situation, which can then break down the cycle of ongoing anxiety and worry. What I would certainly say to you is that if you are finding that anxiety is interfering with your life and it's causing you distress, do go and talk to your general practitioner or doctor to see what they would recommend, or try and get some help through a cognitive behaviour therapist, because really life can be different. Anxiety is something that's useful in small doses and we all have it, but when it's dominating your life, that's not fair, and you should have a way of having having things better for yourself. And I'd encourage you to seek out that help, and good luck on your journey.